So the topic is liver health and hepatitis and how glutathione can help. Okay, so let's get familiar with the liver first. The liver is sitting right under your diaphragm on the right side of your body. And right under the liver is the gallbladder. And to the left of the liver is your stomach, as you can see. And under the liver on the right side, then is the, the stomach continues to the duodenum and then become the small intestines. Okay, so I hope you're familiar with the anatomy. Okay, so the liver is the largest internal organ, but the largest organ of the body is the skin. Many of us don't think of the skin as an organ. Now, the liver performs many metabolic functions, including manufacturing, processing, storage, detox, and many other functions. Therefore, it is a very busy, hard-working organ. Hence, if it is diseased, then the body's overall health will definitely be affected. So, liver diseases can be caused by poor dietary habits, for example, a non-alcoholic fatty liver disease, which is very common. Excess alcohol can give rise to alcoholic fatty liver disease. And then you have drugs and poisons, which may end up with the liver becoming cirrhotic. And then a whole range of viruses, starting with hepatitis A, hepatitis B, hepatitis C. Now, there are many more, but these are the three that we're most familiar with. And then there are the inherited diseases, hemochromatosis, Wilson disease, that affect the liver. And then, of course, you have liver cancer, which is mostly induced by chronic hepatitis B and chronic hepatitis C infections. Okay, perhaps the most common liver problem is fatty liver. Of adults, at least 50% will have some degree of fatty liver by ultrasound. You can see fatty liver just means that the liver is being infiltrated by fat. And looking around at the number of fat people around us nowadays, it's not surprising at all. So now, but it's not something that we can just laugh off, because this non-alcoholic fatty liver disease can progress, right, to become an inflammatory condition called NASH, right, which is non-alcoholic steatohepatitis. That means the fat and the liver tissue that contains it becomes inflamed. And NASH is the most severe form of non-alcoholic fatty liver disease, a condition in which the liver builds up excessive fat deposits, right? And if nothing is done, then it can progress to cirrhosis. So what is cirrhosis? We'll come to that later. And then we move on to the other group of diseases, the hepatitis, which we normally would refer to the viral hepatitis. But hepatitis by itself means inflammation of the liver from whatever cause. So one of the most common cause is infections, and the most common liver infection is by the hepatitis B virus, or HBV. It is estimated that HBV infections cause 1 to 2 million deaths yearly worldwide. Less common are infections by hepatitis A, HAV, and hepatitis C, HCV viruses. Excess alcohol can cause alcoholic fatty liver disease and alcoholic hepatitis, okay? Inflammation due to damage from alcohol. The symptoms of hepatitis, whatever is the cause, are quite similar. And these may include tiredness, loss of appetite, nausea, vomiting, abdominal pain, jaundice, that is yellow discoloration of the white of the eyes and skin, and tea-colored urine. However, in the early stages, there may not be any symptoms at all. Okay, as mentioned earlier on, in 2 days' time, we'll be celebrating World Hepatitis Day. So it is timely to be reminded that this is not a disease that can just be ignored when 1 to 2 million people die yearly. So let's zoom in into the number one cause of hepatitis, and that is the hepatitis B virus. And 80% of liver cancer is associated with HBV infection. Fortunately, the prevalence of HBV infection is falling steadily since our health ministry started the universal anti-hepatitis B immunization program. This was started in 1989. Yeah, vaccines were given to all newborns since 1989. At the same time, all non-immune children and adults were also encouraged to get vaccinated. Right? Now, it is now 34 years since the program for newborns started, and it is expected that the incidence of liver cancer will start to decline significantly as this group entered the high-risk age group for liver cancer, which is above 40 years of age. We are already seeing the effect of the vaccination program on the older children and adults, as the incidence of liver cancer has been declining in the last decade. How does hepatitis B spread? It spreads by transmission of infected blood through sexual contact and from mother to fetus or infant. The transmission through contaminated needles among drug addicts is similar to the transmission of HIV. However, hepatitis B virus is 100 times more transmissible than HIV, right? You need very much less transfer of the fluid to get infected by HBV compared to HIV. Fortunately, while it is 100 times more transmissible, it is 100 times less likely to become chronic compared to HIV. Now, most people develop natural immunity against HBV after being infected, and only less than 10% continue to chronic infection and may develop the complications later on, some progressing to liver cancer. On the other hand, most people who get infected with HIV will progress to AIDS over time. But the advent of powerful drugs has made HIV/AIDS a much less harmful disease than before. So as mentioned earlier on, the anti-hepatitis B immunization or vaccination program has been successful, has achieved its aim. It is very important to get vaccinated against HBV, as it is one sure way to prevent chronic HBV infection and avoid liver cancer. So this is one of the cancers that you can vaccinate against, indirectly. Studies show that the immunity can last up to 20 years after vaccination. Although those at high risk, example, healthcare workers, are advised to get booster doses every 5 years for assurance. There are a number of people who cannot become immune even after completing the HBV vaccination schedule. They have to be extra careful not to get infected. If you are uncertain of your HBV immunity status, get yourself tested and get vaccinated if you are not immune, even if you had been vaccinated in the past. Or get a booster dose if your immunity is too low. So when you do the HBV immune status test, then it will indicate the level of immunity, either 0 or very low, which you need a booster, or adequate. Remember, the best protection against HBV infection is to get immunized or vaccinated. So please do check your immunity status if you're not sure. What about hepatitis C virus, HCV? HCV infection and transmission are quite similar to that of HBV, but it is less common. However, it is more likely to lead to chronic liver disease, cirrhosis, and its complications, and liver cancer compared to HBV. There is yet no vaccine against HCV, and the best way to prevent it is by avoiding behaviors that can spread the virus, especially avoid injecting illegal drugs. What about hepatitis A virus? HAV infection usually occurs through eating food or drinking water that is contaminated by the virus. Contamination is actually from the stool of an infected person. And that infected person is usually a food handler. It can also spread via sexual contact. Unlike the typical food poisoning, the symptoms of HAV infection often only appear after 2 weeks of infection. Apart from the symptoms of hepatitis as described earlier on, some may have fever and diarrhea. Older people tend to have more severe symptoms and may require hospitalization. Acute hepatitis A is usually mild and resolves within 6 months. Very few get serious acute hepatitis or progress to chronic liver disease. So good personal hygiene with proper hand washing and sanitation are the main steps against HAV infection. And most important is the need to wash our hands with soap and water after using the toilet and before preparing food for eating. Although vaccines are available, these are not made compulsory like the HBV vaccines because the disease is usually mild. But since most cases can be serious and chronic, it is still advisable to get vaccinated, especially if you are involved in preparing or serving food to others, okay? Most of the people who work in the food industry, they should get vaccinated against hepatitis A as well as hepatitis B. Because one infected person can infect many, many others, right? When you contaminate the food or the water that you're handling, if you're infected, so everybody else that consumes that is going to get infected. So fatty liver disease, hepatitis can all then progress to liver cirrhosis, and from liver cirrhosis can progress to liver cancer. Liver diseases can progress to cirrhosis, which is a condition in which the liver becomes damaged and scarred, leaving much less healthy functioning liver tissue. Because of the scarring, blood flow to the liver is hampered, and liver function declines, and as the condition worsens, then you may end up in liver failure. And this is a fatal condition unless a liver transplant is done. So these are the signs of liver cirrhosis. Of course, you get jaundice, then you get encephalopathy, there's confusion. That's because of the accumulation of the byproducts of metabolism that the liver usually processes, but now cannot be processed. And then you have spider angioma, that's a blood vessel breaking out like spider web, like loose hair, there's muscle wasting, then the blood vessels on the abdomen becomes widened because of the high pressure inside. Then you have ascites, there's accumulation of fluid in the abdomen, all right? Then you get red palms, that's because of the circulation there. And of course, the liver is all scarred and non-functional. Finally, you get liver cancer. Liver cancer is among the cancers with very bad prognosis. It is the 6th most common cancer worldwide and the 8th most common cancer in Malaysia. It is mostly induced by chronic hepatitis B and hepatitis C infections. So you start with the acute infection of the hepatitis B or C virus. And then most, especially hepatitis B, most will recover, but some will then proceed to become chronic and then progress to fibrosis, and then severe fibrosis will lead to will be cirrhosis. And once it's cirrhotic, 2 to 6% of cirrhotic livers become cancerous per year. Okay, so what do we need to do to protect and keep our liver healthy? So we must eat healthy, well-balanced diet with plenty of fruits and veggies and limit salt and sugar intake, maintain a healthy weight and do regular exercises. And if you drink alcohol, keep it to the minimum, better to avoid, and consider dietary supplements that are known to be beneficial for the liver. And the most important is to boost glutathione. And why? We will see after this. And of course, a reminder to get yourself immunized against HBV and also HAV if you're not yet immunized. Okay, now let's see why the most important supplement to consider is a supplement that boosts glutathione. All right. We mentioned earlier on that the liver has many functions, all crucial for our survival and for health. And glutathione is the main protector and detoxifier for the liver. The liver does a lot of detoxification of other stuff. So, and it uses glutathione. And glutathione also protects the liver from these toxins that it has to work on. Glutathione is involved in most of the many functions of the liver. The liver has many functions, but apart from detoxifying, but the other functions also require glutathione. And glutathione is very useful because of these many functions. And it's useful for the liver and other organs as well. But just look at how useful it is for the liver. Of the many functions performed by the liver, most of them require glutathione. As mentioned, detox work, removing potentially toxic byproducts of certain medications and other toxins require glutathione. The metabolism of breaking down nutrients from food to produce energy when needed also requires glutathione. To fight infection, to counter bacteria that's in the blood requires a strong immune system. To be protecting in the liver itself requires glutathione. The production of proteins in the liver requires glutathione. Okay, so other functions of the liver also, to a certain degree, also require glutathione. In regulating the blood clotting is also one of the functions of the liver, also requires glutathione. So, you can almost say that almost every function of the liver requires glutathione. So that's why liver has the highest concentration of glutathione compared to all the other organs in the body. Okay, so we know that glutathione is crucial, very crucial for liver health and liver function. But unfortunately, we also know that as part of our aging process, our production and therefore level of glutathione goes down after age 20. And as we age and the level goes down by about 10 to 15% every decade, then we're going to be significantly troubled by the lack of glutathione as we age, and the liver will be among the first organs to suffer. So what do we do? How do we try to prevent the decline of glutathione to adversely affect our health? Fortunately, scientists have discovered it is possible to restore the levels of glutathione by taking glutathione precursors that can reboot, right, the glutathione production system. Okay, this is how we do it, right? Unfortunately, even though the food that we eat, the plants and animals that we eat, they also contain glutathione to protect themselves. But glutathione is so fragile, it just gets digested when we eat glutathione itself. So scientists have discovered that the best way to help our body is to provide cysteine, which is the rate-limiting precursor. It is the amino acid, one of the 3 amino acids that make up glutathione. The other 2 are glutamic acid and glycine. But glutamic acid and glycine are plentiful in the diet unless you're severely malnourished. So the scientists have discovered that all we need to do is to provide cysteine in a stable form that it can withstand the digestive system and get absorbed and be made available for the cells to produce glutathione. Okay, and right now on the market, the best source of stable cysteine is ribosine, which is actually a molecule called ribocysteine. Ribose plus cysteine, shortened to ribocysteine and trademarked as ribosine. And ribosine is 300% better, more efficient in boosting glutathione compared to the next best precursor, which is NAC. Okay, and we have ribosine in 2 of our products. Max 1 is 100% ribosine, and Sungevity is ribosine plus 12 are the ingredients that work synergistically to improve your health, to give many anti-aging benefits, and also to help your liver health. Okay, so that's tonight's sharing on liver health and hepatitis and how glutathione can help. Thank you very much.